Hi everyone, the date is the 22nd of March. I wanted to give you a bit of a reflection on the whole week. So just to give you some context, we started the blog on Monday and there was 1,372 cases in the UK, and as of today there's 5,018. We know the numbers are inevitably much higher than that because we're not testing people. People are supposed to be staying at home. But either way, it gives us an idea of the trend that we're having. There's loads of things I want to talk about in this video. But firstly, I'm definitely a lot less anxious than I was when I started the week, despite just having mentioned the numbers increasing as they are. I'm not quite sure why that is. I think I had a lot of nervous energy, being off for a couple of weeks and then coming into the emergency department, what I might see. But you realise that the actual medicine that I need to do, I have that well within my grasp. And I've been a doctor 5 years now, and I've been put into some positions that have been really, I would say, beyond what I felt I was capable of. I've seen young people pass away in traumatic circumstances, and we see death on, depending on your specialty, on a kind of regular basis. And also I've been put in positions where I haven't been able to provide the care that I wanted, and I felt stretched, and it sits heavy with you. So we do have experience in this. So what is the difference about this episode? Normally those things happen over kind of minutes or hours over a shift, and in the big scheme of things, you're not regularly subjected to that kind of trauma. Whereas now, this is going to go on for days, weeks, months. That's the real difference. And what I was saying before about the actual, technically the medicine is okay. It's really the, I guess, physical and emotional strain in physically dealing with that number of patients. And it harks back to the tweets I read on the very first blog by the ICU consultant in Bergamo in northern Italy, Dr. Mancini. We're no longer surgeons or specialty consultants, we're all doctors. It's not about having particular technical specialties, it is about dealing with the number of patients we're going to see. The medicine itself is very simple. There's not a lot we can do. It's supportive therapy or monitoring. Really where the shortage lies is with the ICU capacity and the ventilators and all the staff that come along with managing those ventilators. So I can be reassured that my knowledge in terms of medicine is going to be okay. It may be the wrong time to bang this drum, but we've had so much support for the NHS in the last days to weeks, and I do feel like we could have done with it over the last few years, because before all this I was seeing things on the ward that needed to be changed, and fair play, the transformation I've seen has been absolutely unbelievable in a really good way. I feel like, why couldn't this stuff have been done over the last few years? Don't forget, in 2017 the British Red Cross declared the NHS faces a humanitarian crisis. And again, not wanting to bang the drum on this as well, but how much money have we spent on kind of military and defence projects, and something like this happens, which, okay, it wasn't inevitable, but it's something we should have been preparing for. But why hasn't there been more investment in planning for this kind of eventuality? But you have to put that stuff to the back of your mind, because it's not the time to criticise. People need to just work with what they got and do the best we can at the moment. It's been really useful learning from the consultants. I think part of my anxiety when I started the week, I felt that I'd have to take on a lot of things independently, but I realised from chatting to Dr. Hudson and chatting to Dr. Jenkins that they're going to be there for patients, they're going to be there for junior members of staff like me. We're going to support each other through this. You probably noticed on the vlog so far, the hospital that I'm working at and the work I'm doing is much the same as before, and I've had a few people write in and say, why are you doing this? You haven't seen any COVID-19 patients. Well, I've been around them, my colleagues have been seeing them, and this is the start of the journey for us. I wanted to capture the change in things. We're already seeing changes in the UK. You look at places like Northwick Park Hospital in London have already declared a critical incident due to the lack of ICU beds. because of the coronavirus. The UK is a microcosm for what's happening all around the world. So depending on how early you get the community spread of coronavirus, the time that it hits your particular area could be weeks apart. But if you look at all the projections, it's inevitably going to be coming to my hospital in the next days or weeks. We just have to do all we can for preparation. And the preparation I've seen, as I alluded to before, has been absolutely staggering. One of the biggest things I noticed was that we have a lot of patients with social problems on the ward. So, general medical patients, typically elderly patients that we're needing to sort out care so they can get discharged home safely. There's been a huge input into that side where we're getting loads of patients home that would normally be stuck on the wards for days and weeks. Does make you ask the question, why hasn't that been happening that quickly before? We've also seen clinics, outpatient clinics, people that come into the hospital for their long-term conditions, they've been rearranged. We'll pay the cost of that, I'm sure, in the long term. And we're seeing more specialties as well getting directly involved in patients in A&E. So typically in the emergency department, we'd have to refer to a specialty, but we're seeing those specialties right on hand to take the burden off us for, patients that would normally be coming into hospital outside this Covid-19, to allow us to put our resources to the patients coming in. So we're seeing some really great positive changes happening, and it's also in part to you, the general public, using your NHS more sensibly. I'm seeing a lot fewer patients coming in that didn't need to be. Yes, this week we saw people with very mild COVID-19 type cases. Just follow the advice. Don't come in unless you need to. And I have to say, from my experience, the general public, you guys are doing a fantastic job with that. Some of the issues I'm picking up on from the junior doctors on the ward, one of the big ones is personal protective equipment. So PPE, the masks, the gowns, the goggles, the gloves. You might have seen it in the news that people are very concerned about shortages. That's something I haven't experienced at the moment, but I know is a huge concern amongst doctors to try and reduce their risk of exposure. It does affect young people as well, so we should take it seriously as young people and health professionals. The other thing I want to highlight is testing. So currently NHS staff aren't being tested for the coronavirus routinely, and I saw this article in the news that a few patients from the Portsmouth football team, so a soccer team here in the UK, have tested positive, but they're fine. I'm glad they're doing well, and they said they're waiting the test for the rest of the squad. Now, why the hell is a Premier League football team getting their whole squad tested, yet people in my department cannot get tested for the coronavirus? We have to obviously adhere to all the self-isolation rules that you guys are adhering to. So if we get a fever or a cough, we have to self-isolate. Now, a lot of our senior doctors, senior nurses, healthcare professionals across the board are self-isolating. So if they have a cough or a cold for like 2 days, they have to self-isolate for 7 days without getting a test. It might not even be coronavirus. We need those healthcare professionals on the ground. Why aren't we getting priority tested, but like a Premier League football team is? Last thing I want to do is just talk about the vlog, and thank you so much for the support. It's just been absolutely incredible, and as you know from the vlog, I haven't done a lot differently this week, so I think you just appreciate the fact that I'm covering this and spending time talking to you about it. So really, I know those thanks are for the healthcare system in general, all around the world, not just the UK, and also all those thanks and support I'm going to kind of put in a little pot, and when things do get really tough and I'm struggling, I can pull them out and use that to supercharge me. You've probably seen with the upload schedule as well, this isn't going to be a daily thing. I'm going to try and do as much as possible, maybe 3 or 4 videos a week, and I know in the comments people have said, once things get going, it'll be really difficult. I've made plans for that. I've got an editor on board. I'm going to set up a little diary room here, so quite literally all I need to do is come in, chat for a couple minutes and put something out. This is for me an important part of the journey. I found it so far so therapeutic. As I said, talking to the consultants, I've learned so much. Also, you have to bear this video in mind about the context that's happening around the country. I'm not a spokesperson for every doctor or junior doctor around the country, so in these I'm not gathering gathering like a journalist would, lots of different views, or I'm not getting a consensus. This is just my experience about what's going on. Inevitably, I have to maintain professionalism and think about that impact, the stuff I might be putting out, because some of my colleagues are working crazy hard at the moment. So I'd hate for you to read everything that's going on and then watch my vlog and think things aren't really that bad on the ground. You have to get your information from different sources, and I don't feel like I have the time to find all those stories to put them in the vlog. This is very much my experience. I do plan, as you've seen, to get other people in and connect with other people as I go through the journey for my learning, and to document the experience. Oh, Sonya, you're here.
Hello.
Do you want to come in and have a quick chat?
Yeah, sure.
Come on in. How are you feeling about things?
I'm good, I'm just waking up. So.
I love the way you come in. Sonya, come on, get on the video.
No, it's good. I just, looking back, think, wow, what a lot of stuff we've done. Now is the time to distance. Now is the time to try and flatten that curve, because this is exponential. This is not a straight line. This is exponential. And unless we act now, we're going to be overwhelmed in a couple of weeks' time. Unless we act responsibly as a country on this, then further restrictions will follow. I think that ball is in our court now. Because
we've seen the line tracking, and it's scary, isn't it?
Yeah, but if we all act responsibly, we can do this. We can, and we will, because the great British spirit will come through.
And there's no other way out. It's not just going to disappear. There's no other way out.
This is not a simulation. This is not a drill. It's real. No one wants to be here. We all wish we weren't, but we are. And in many ways, it's World War III. We've got a common enemy. Unfortunately, it's very small and we can't see it, which makes it difficult to control it.
And also difficult to get the message across. People can be very blasé about that.
Oh, yeah.
Because it's difficult to visualise that type of thing. How are you feeling yourself? Obviously you got a day off today. Do you feel quite zen, or it's Mother's Day as well, so that's
I was trying to have a kip just now, and then got called by the hospital with someone wanting to talk about everything we're doing, which was fine because it's an important thing to chat.
Sure.
But what's becoming apparent is I think downtime, as important as it is at the moment, is a little bit scarce. A bit sad that I can't see my mum, but Mum, happy Mother's Day. I love you lots. I hope you got the flowers. And
you're showing me up. I haven't said happy Mother's Day yet. Thank you so much, Sonya. I'll let you have the rest of your day to relax.
Yeah, thanks, Ed.
Oh, awesome. Nice to have a little cameo from Sonya there. I'll wrap this video up now. I've had the last couple of days off, and I watched a video by one of my friends, Mark Jager, who's a philosophy professor in the University of Nottingham. I'll leave a link up there, and he gives some tips on what to do when you're isolating. Obviously, we're not self-isolating, but I'm reducing my contact. And one of the things he said is do something creative. So I wrote a little song as well about the coronavirus. Oh, it sounds so ridiculous when you say it. But no, it's supposed to be sincere. If you guys want to see it, I will upload it. Just let me know down below. All right. That's it. Stay safe, everyone. That seems to be the mantra that's coming out from everyone. I really appreciate the support, and I'll be back very soon. Hi, Mum. Happy Mother's Day.